Bismillahirrahmanirrahim. I'm Dr. Rashida Arif, working as Associate Professor of Gynae. As we all know, that the holy month of Ramadan is here, and we are receiving a lot of messages from our patients that can we fast during the pregnancy, and what can be the harms of fasting during the pregnancy. So I thought to make a video on this so we can guide our patients in a better way. Okay, in this video, I will discuss that what the Islam says about fasting during pregnancy and what advice we can give to our patients, what are the safety tips, and then I will discuss a study that I did in Nishtar Hospital, Multan in 2020 about Ramadan fasting during pregnancy. So, what Islam says. Islam says that women choose to fast if they are healthy and they are able to tolerate. However, Islam allows pregnant women to skip fasting if there is fear of harm to themselves or their baby. Okay? So, if they feel that they are healthy and they are able to tolerate the fast, then they should fast. But at the same time, Allah doesn't like hardships for any Muslim, and women can skip fasting if there is fear of harm to themselves or their baby. And if we talk about medically a woman can fast during the pregnancy if she is healthy, if she has no pregnancy complications, she doesn't feel excessive weakness, dizziness, or dehydration, and she can eat a balanced sahur and iftar with enough fluids, proteins, and nutrients. So these are the conditions in which fasting will not harm the baby or the woman. But if these conditions they are not fulfilled and woman has any pregnancy complications like preeclampsia, diabetes, reduced liquor, or if it is not recommended by her doctor, then she can skip the fasting according to Islam. These are some safety tips that we can tell to our patients that they should take plenty of fluids between iftar and sahur. They should eat nutritious food that includes dates, whole grains, proteins, fruits, and vegetables. And at the same time, they should avoid caffeine and sugary foods to prevent the dehydration. Like they should not take too much fizzy drinks like Coca-Cola, cold drinks, or sweet things. And they should eat healthy foods, fruits, vegetables, and proteins with enough fluids. They should rest well and avoid overexertion. And along with this, they should monitor the baby movements and overall health. And this was a study that I did in 2020 in Nishtar Hospital, Multan. And the idea was so much liked by the chief editor, Mr. Shaukat Javed, who is the chief editor of Pakistan Journal of Medical Sciences. That is an international peer-reviewed medical journal. That he mentioned this title on the cover page of this on the cover page of this journal. It is written here: Maternal and perinatal outcome after Ramadan fasting, and it was published in this journal in 2020 on page 894. The objective of my study was to determine the maternal and the perinatal outcome after Ramadan fasting during pregnancy. As we all know that Muslims fast during the month of Ramadan and fasting is compulsory in their religion. And if the mother is malnourished, it can affect the maternal metabolism. So we must know that what advice we can give to our patients for a healthy pregnancy. So we included 226 women in this study who were attending the labor room of Nishtar Hospital, Multan. Their age was 18 to 35 years, and they were having the pregnancy of 15 to 40 weeks. And we divided these women into two groups. In the first group, we included the women who fasted for more than 15 days. And in the second group, we included the women who didn't fast or fasted for less than 15 days. And what we studied, we compared the demographic profile of both groups and we studied the maternal outcome that included mode of delivery, whether they were delivered by cesarean section or by vaginal delivery. And we studied the incidence of preeclampsia, that is raised blood pressure along with proteins in the urine, diabetes during pregnancy, and the preterm labor, that is the labor before the due time. And perinatal outcome we studied, that is the birth weight of the baby, mid-arm circumference, head circumference, and the weight of the placenta. These characteristics we compared in both groups. And what were the results? Results were quite reassuring, and we can tell our patients, and by using these results, um, we can guide our patients in a better way. Here we can see that we included 226 women. Out of 226, 58 women, they fulfilled the criteria to be included in the fasting group, that is 25%, and 74.3% women, they were slotted in the non-fasting group. Okay. And demographic profile of both the women in respect to mother's age, BMI, trimester, gravidity and parity, they were same in both groups. But in the non-fasting group, more women were employed in comparison to the fasting group. So it means working women during pregnancy, they fast less as compared to the non-working women. Okay, this was the difference in the demographic characteristics of both the groups. Then coming to the maternal outcome, we compared the mode of delivery, that whether they were delivered by cesarean section or by vaginal delivery. Second, we studied about the incidence of diabetes during pregnancy. Then we studied about the incidence of high blood pressure during the pregnancy and incidence of delivering before due time. These characteristics, they were compared between both fasting and the non-fasting groups. And the results were that there was no significant difference among both groups. Okay. And regarding the perinatal outcome, we studied about the birth weight of the baby, height of the baby, head circumference, mid-arm circumference, and weight of the placenta. And there was no significant difference in between both the study groups. These um, characteristics, they were the same in both fasting and the non-fasting group. So what was the conclusion of the study? That fasting women were not found to have poor maternal and fetal outcome when they were compared to the non-fasting women. So it was quite reassuring for the fasting women that there was no difference in the incidence of preeclampsia, that is high blood pressure, diabetes, and the incidence of delivering before the due time. And there was no difference in the mode of delivery, that they were delivered by cesarean section or by the vaginal delivery. So we can guide our patients. And regarding the fetal outcome, baby outcome, there was no difference in the weight of the baby, mid-arm circumference, head circumference, and the height of the baby, and the weight of the placenta. Many of our patients, they ask from us that if we fast, our baby will be weak, and if we don't eat enough, if then there can be pregnancy complications. So we can quote this study while guiding our patients, while giving the advice to our patients. And this question is also asked by many patients, that if we cannot fast, then what are the alternatives? So Islam allows alternatives, that women can make up the missed fast later, that is qaza, if she can, after the pregnancy. So जितने रोजे उसके छूट गए हैं वो बाद में रख सकती है, ठीक है। नमाज की कज़ा नहीं है, like during the menstrual cycle, women can miss the prayer, and she has not to make the qaza, but she has to make the qada of fast. And the second option is, if she is not able to fast even after the pregnancy, she can give fidya. What is fidya? That she can feed a poor person for each missed fast, if she is unable to fast even after the pregnancy. So these are the basic tips that all of the gynecologists must know so that we can guide our patients in a better way. Thank you very much. If you have any question, you can ask me in the comment section. Thank you.